Today we're venturing into a topic that is incredibly important for anyone affected by diabetes: medications. While medications play an integral role in managing various health conditions, it's essential to be aware of their potential risks. The FDA, or the US Food and Drug Administration, regularly reviews and updates the public on medications that might pose risks to certain individuals. For our diabetic friends, we've delved deep to bring you a list of the top 5 medications that the FDA warns could be dangerous. Grab a cup of tea or coffee, and let's dive right in. Before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button and hit subscribe. Thank you, and let's begin. Statins are a class of drugs often prescribed to lower cholesterol levels in the blood. By reducing cholesterol, they help prevent heart attacks and stroke. Now you might wonder, why would a medication that's good for the heart be on this list? Well, while statins do a great job at what they're prescribed for, there's a catch. Studies have shown that statins can increase the risk of developing diabetes, especially in individuals with other risk factors for the disease. A study published in the Journal of the American Medical Association noted that higher doses of statins were associated with an increased risk of diabetes compared to moderate doses. While the overall risk might be small, it's a significant consideration, especially for those already predisposed to diabetes. Commonly prescribed for hypertension, high blood pressure, thiazide diuretics help the kidneys get rid of excess salt and water from the body. But here's where the plot thickens. Thiazide diuretics can increase blood sugar levels, posing a risk for diabetics. Research conducted and published in the New England Journal of Medicine indicated that patients on thiazide diuretics showed increased blood sugar levels. The change wasn't massive, but for diabetics, even small shifts can have significant implications. If you're prescribed a thiazide diuretic and have diabetes, regular monitoring of your blood sugar and consultation with your healthcare provider is a must. Beta blockers are another class of drugs used primarily to manage heart conditions and high blood pressure. They work by blocking the effects of adrenaline, which can slow down the heart rate and reduce blood pressure. However, there's a downside for diabetics. Beta blockers can mask the symptoms of low blood sugar, hypoglycemia. This is a significant concern because recognizing and treating hypoglycemia early is crucial for those with diabetes. A study in the Journal of Clinical Pharmacy and Therapeutics underscored this concern, noting that beta blockers, especially non-selective ones, might mask hypoglycemic symptoms, which could delay necessary interventions. If you're a diabetic on a beta blocker, being aware of this potential side effect and having regular check-ins with your doctor is essential. Antibiotics are lifesavers. They fight bacterial infections and have revolutionized medicine. But as with all good things, there are often caveats. Fluoroquinolones are a class of antibiotics used to treat a variety of infections. However, the FDA has issued warnings about them causing sudden and severe drops in blood sugar levels, leading to hypoglycemia. A review of adverse events sent to the FDA revealed that some patients on fluoroquinolones experienced hypoglycemic coma, a severe and life-threatening condition. While these events were rare, the severity of the potential side effects can't be ignored. If you have diabetes and are prescribed a fluoroquinolone antibiotic, it's crucial to monitor your blood sugar levels closely and report any unusual changes to your healthcare provider. Now, as promised, we've saved the most alarming for last. SGLT2 inhibitors are a class of drugs specifically designed to treat type 2 diabetes. They work by helping the kidneys remove glucose from the bloodstream. Sounds perfect for diabetics, right? Well, not so fast. The FDA has issued warnings about a rare but severe side effect of these medications, a condition called Fournier's gangrene, a flesh-eating bacterial infection of the genital area. A study highlighted by the FDA identified several cases of Fournier's gangrene in patients taking SGLT2 inhibitors. The condition is rare but can be life-threatening and requires urgent medical attention and often surgery. It's a sobering reminder that even medications specifically designed for diabetes can come with severe risks. Effective management of diabetes is crucial in preventing complications and maintaining overall health. To aid in this endeavor, the US Food and Drug Administration, FDA, has approved a range of medications designed to help individuals with diabetes control their blood sugar levels. Metformin. Metformin works through several mechanisms, primarily by reducing the liver's production of glucose, increasing insulin sensitivity in muscle cells, and slowing down the absorption of glucose in the intestines. By doing so, it helps lower blood sugar levels. It is often considered the first-line treatment for type 2 diabetes because it is effective and generally associated with a lower risk of causing weight gain compared to other diabetes medications. Insulin. In diabetes, the body either does not produce enough insulin, type 1 diabetes, or cannot effectively use the insulin it produces, type 2 diabetes. As a result, individuals with diabetes may need insulin therapy. There are various types of insulin, including rapid-acting, short-acting, intermediate-acting, and long-acting formulations. The choice of insulin type and regimen depends on the individual's needs, lifestyle, and blood sugar control goals. Insulin is administered through injection or insulin pumps and is essential for many people with diabetes to maintain proper blood glucose levels. Sulfonylureas. Sulfonylureas are a class of oral medications commonly prescribed for type 2 diabetes. They work by stimulating the pancreas to release more insulin. This increase in insulin helps lower blood sugar levels by promoting glucose uptake into cells. Sulfonylureas have been in use for many years and can be an effective option when lifestyle changes and metformin alone are insufficient for glycemic control. However, they may have side effects, including an increased risk of hypoglycemia, low blood sugar, and weight gain. Dipeptidyl peptidase 4 inhibitors. DPP4 inhibitors are oral medications used to manage type 2 diabetes. They work by increasing the levels of incretin hormones, such as GLP-1, which stimulate insulin release and inhibit the release of glucagon. This helps lower blood sugar levels in a glucose-dependent manner, meaning it primarily acts when blood sugar levels are elevated. DPP4 inhibitors are often used as a second-line treatment option, either alone or in combination with other medications. They are generally well tolerated and do not cause hypoglycemia as frequently as some other diabetes medications. GLP-1 receptor agonists. GLP-1 is released by the gut in response to food and plays a crucial role in regulating blood sugar levels. GLP-1 receptor agonists stimulate the GLP-1 receptors, leading to increased insulin secretion and decreased glucagon production. This combination helps lower blood sugar levels and reduces appetite, often resulting in weight loss. These medications are typically used when other oral medications or insulin alone have not achieved adequate blood sugar control. To wrap things up, medications, while beneficial, come with their set of risks and considerations, especially for those with diabetes. It's essential to be informed and vigilant. Always consult with your healthcare provider about potential side effects, and never hesitate to ask questions or raise concerns. Remember, you're the captain of your health ship, and staying informed is your compass.